So doc, how much radiation do I get exposed to with this type of scan?
The average person gets radiation just from living their daily life on planet Earth, and a coronary CAT scan, in ideal conditions with a well-controlled heart rate, the amount of effective radiation can be less than the radiation a patient receives while doing their daily activity on Earth.
So is it claustrophobic being inside the CT scan machine?
For the vast majority of patients, there is no sensation of claustrophobia. The CT tube is fairly open, and most patients do very well with the CAT scan.
So will that contrast affect my kidneys, doc?
In the vast majority of cases of patients who are being scanned for a coronary CAT scan, the contrast does not affect or injure the kidneys. The most common risk factor for having any kidney injury from contrast is having known pre-existing kidney disease, and we screen for that for all patients who have the test ordered.
What happens if the scan is normal?
That portends a very, very good prognosis for the patient, with some studies showing that up to 10 years after the scan, those patients are free from any clinical cardiovascular events.
Is it safe to take the pre-medications? And
So in order for a coronary CAT scan, in order to have the most diagnostic accuracy, we need a well-controlled heart rate, and we need the arteries that supply the heart to be dilated. Metoprolol is very safe and nitroglycerin are very safe, and both medications are taken to accomplish a well-controlled heart rate and optimal visualization of the coronary arteries.
Who is this test good for? Who qualifies for it?
The most common reason a coronary CAT scan is ordered is because a referring cardiologist is concerned about a patient's symptoms, which may include chest pain or shortness of breath, just to name a few. The test is ideal for patients who are at risk for coronary artery disease, and the cardiologist wants to determine if there's any coronary artery disease explaining their symptoms.